Hello friends, welcome back to our channel. Today, we're diving into a critical yet often overlooked topic, the surprising ways low oxygen levels in your body can manifest. These signs, ranging from subtle discomforts to more alarming symptoms, provide crucial insights into your health. Oxygen is the lifeline of your body, powering every cell and system. When levels dip below normal, your body responds in diverse ways that might not initially seem related, but can indicate underlying issues that require attention. You might notice signs like unusual changes in breathing, persistent fatigue, or even odd sensations in your hands and feet. While some of these symptoms, such as headaches or dizziness, might seem minor, others like cyanosis, a bluish skin tone, or sudden confusion could point to serious medical concerns. In this video, we'll uncover 12 lesser-known but vital warning signs of low oxygen levels in the body. You'll learn how these symptoms relate to oxygen shortages, their potential causes, and why it's important to recognize and address them early. Whether it's a racing heartbeat, excessive sweating, or discoloration of the skin, each sign tells a story about how your body is struggling to cope with insufficient oxygen. We'll also provide practical insights into what these signs mean for your overall health and steps you can take to protect yourself. From understanding conditions like tachycardia, rapid heartbeat, and cyanosis to exploring how chronic illnesses such as COPD or acute conditions like blood clots impact oxygen levels, this video will equip you with valuable knowledge to stay ahead of potential health issues. Stay tuned as we break down each symptom in detail and guide you on how to recognize the signs, seek medical help, and maintain optimal oxygen levels for a healthier life. Let's get started. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. 1. Rapid heartbeat. One of the earliest responses to low oxygen levels is a rapid heartbeat, a condition known as tachycardia. When your body senses a lack of oxygen, your heart starts working overtime to deliver what little oxygen is available to vital organs. This can feel like your heart is racing or pounding even when you're at rest. While this increased heart rate helps keep your organs functioning temporarily, it puts significant strain on your heart and blood vessels. Tachycardia is often accompanied by chest discomfort, feelings of anxiety, fatigue, or dizziness. For individuals with chronic conditions like COPD, chronic obstructive pulmonary disease, or heart failure, or in cases of sudden issues like blood clots in the lungs, this can be a critical warning sign. Without prompt intervention, such as oxygen therapy or treatment for the underlying cause, persistent tachycardia can lead to complications like arrhythmias, irregular heartbeats, or even heart failure. 2. Excessive sweating. Sweating isn't just about cooling down, it's also a stress response. When oxygen levels are critically low, your body releases adrenaline, triggering excessive sweating even in the absence of heat or physical exertion. This often results in cold, clammy skin, signaling that your body is under significant stress. You might notice rapid breathing or a fast heartbeat accompanying the sweating as your body struggles to deliver oxygen to essential organs. People with respiratory conditions like asthma or COPD might experience sudden bouts of sweating during flare-ups, while those exposed to high altitudes or carbon monoxide poisoning might find it an early warning sign. In extreme cases, this symptom could indicate hypoxemic shock, a life-threatening condition where oxygen deprivation starts to impair organ function. While sweating may seem minor, it reflects your body's desperate attempt to cope with an oxygen shortage and should not be ignored. 3. Cyanosis. Cyanosis, characterized by a bluish tint to the skin, lips, or nails, is a telltale sign of critically low oxygen levels in the blood. This occurs when there's too much deoxygenated hemoglobin, a type of hemoglobin that lacks oxygen, circulating through your body. The color change is most noticeable on thin-skinned areas like the lips, fingertips, or mucous membranes, such as the inside of the mouth or eyelids. However, for individuals with darker skin tones, it might be less apparent and could appear as a grayish or pale tone instead. Cyanosis can result from a variety of causes, ranging from sudden blockages like choking or severe asthma attacks to chronic conditions like COPD or congenital heart defects. In newborns, it may indicate serious issues such as congenital heart disease or breathing problems. The speed at which cyanosis develops provides important clues. A sudden onset may suggest emergencies like a pulmonary embolism, a blood clot in the lungs, while gradual development could point to long-term conditions like heart or lung disease. Regardless, cyanosis always warrants immediate medical attention as it signals that oxygen isn't reaching your tissues effectively. 4. Confusion. When oxygen levels in the blood drop, one of the first and most noticeable effects can appear in the brain, a highly oxygen-dependent organ. Confusion or memory loss often emerges because the brain is not receiving enough oxygen to sustain its normal functions, such as thinking, focusing, and recalling information. This deficit can range from subtle signs like mild forgetfulness or difficulty concentrating to more severe manifestations such as struggling to make decisions, follow simple instructions, or remember recent events. In early stages, symptoms might include trouble finding the right words during conversations, feeling disoriented in familiar surroundings, or forgetting routine tasks. In more serious cases, individuals may appear dazed, fail to recognize people or their environment, or have difficulty understanding situations around them. These cognitive changes often signal underlying conditions like chronic obstructive pulmonary disease, COPD, sleep apnea, or acute issues such as carbon monoxide poisoning. High-altitude environments, where oxygen levels are naturally lower, can also lead to confusion as part of altitude sickness. These examples underscore how crucial oxygen is for maintaining clear thinking and overall brain function. If confusion is left unaddressed, it can escalate into more severe neurological problems, highlighting the importance of recognizing and treating the root cause promptly. 5. Euphoria. A less common but equally significant symptom of oxygen deprivation is a sense of euphoria, or feeling disconnected from reality. This occurs when the brain struggles with low oxygen levels but compensates by releasing stress hormones like adrenaline, creating a temporary feeling of happiness, calm, or even exhilaration. While this state may seem harmless, it is dangerous because it masks the seriousness of the situation. During these episodes, individuals might feel overly confident or fail to notice critical warning signs, such as labored breathing, a rapid heartbeat, or bluish skin. Euphoria is often seen in cases of altitude sickness, where climbers sometimes report a sudden surge of joy or excitement just before their condition worsens. Though the brain's chemical response may offer a brief sense of relief, prolonged oxygen deprivation can cause severe consequences, such as fainting, seizures, or even loss of consciousness. Recognizing euphoria as a potential warning sign of hypoxia, low oxygen levels, is essential to preventing further complications. Immediate action, such as descending to lower altitudes or seeking medical help, can mitigate the risks. 6. Visual problems. Visual disturbances are another important, though frequently overlooked, symptom of low oxygen levels. The eyes, particularly the retina and optic nerve, are highly sensitive to oxygen shortages. When deprived of sufficient oxygen, these components can malfunction, resulting in a range of visual problems. Blurred vision is often the first sign, manifesting as difficulty focusing, a hazy view, or trouble seeing objects clearly at the periphery of your vision. Some individuals may experience seeing spots, flashes of light, or patterns similar to migraine auras. In severe cases, symptoms can escalate to tunnel vision, where only the center of the visual field is clear, or even brief total vision loss. These issues might improve when oxygen levels are restored, but recurring episodes can cause long-term damage to the retina or optic nerve, potentially leading to permanent vision loss. Conditions like COPD, sleep apnea, or carbon monoxide poisoning are common culprits, while sudden episodes may occur at high altitudes or during severe respiratory illnesses. Early recognition and treatment of the underlying oxygen deficiency are crucial to preserving vision and preventing lasting harm. 7. Feeling lightheaded. Lightheadedness or dizziness is another common early indicator of low oxygen levels. The brain requires a continuous supply of oxygen to maintain balance, orientation, and overall functionality. When oxygen delivery is compromised, it struggles to keep up, often resulting in sensations of unsteadiness, vertigo, or a feeling that the room is spinning. These symptoms can come on suddenly and may worsen when standing up too quickly, a condition known as orthostatic hypotension, which is exacerbated by low oxygen levels. In more severe cases, oxygen deprivation can lead to fainting or a brief loss of consciousness, as the brain prioritizes oxygen flow to critical organs over maintaining full awareness. Chronic conditions such as anemia, lung diseases, or heart problems often result in persistent dizziness due to the body's inability to carry or deliver adequate oxygen. The inner ear, which plays a crucial role in balance, is also affected by reduced oxygen, contributing to feelings of disorientation or vertigo. Sudden or severe episodes of dizziness should not be ignored, as they may indicate serious issues such as carbon monoxide poisoning, altitude sickness, or a pulmonary embolism. Addressing the underlying cause, whether through supplemental oxygen, medications, or lifestyle changes, can alleviate these symptoms and prevent further complications. 8. Persistent drowsiness. Constant fatigue or drowsiness that doesn't improve with rest is a telling symptom of low oxygen levels. Oxygen is essential for cellular energy production, and when cells don't receive enough, energy levels drop, leaving you feeling persistently tired. This type of fatigue often extends beyond physical exhaustion, impacting mental alertness and the ability to complete even simple daily tasks. Muscle weakness frequently accompanies drowsiness, as oxygen-starved muscles recover more slowly and may feel heavy, sore, or achy after minimal exertion. Mentally, low oxygen levels can lead to difficulty focusing, staying alert, or performing routine activities such as reading or holding a conversation. Long-term fatigue is a hallmark symptom of chronic conditions like COPD, sleep apnea, or congestive heart failure. These illnesses reduce the efficiency of oxygen delivery, causing a constant drain on energy levels. In acute situations, such as severe respiratory infections or exposure to high altitudes, drowsiness can escalate rapidly and may signal a critical need for medical intervention. Recognizing persistent fatigue as a potential warning sign of oxygen deprivation is crucial. Treating the root cause, whether through lifestyle modifications, medical therapies, or supplemental oxygen, can help restore energy and improve quality of life. Understanding how low oxygen levels manifest through symptoms like confusion, euphoria, visual disturbances, dizziness, and fatigue is critical to safeguarding your health. These signs often seem unrelated at first glance, but are deeply interconnected as the body struggles to maintain essential functions in the face of oxygen deprivation. Recognizing these symptoms early allows for timely intervention, whether through oxygen therapy, medical treatment, or addressing underlying conditions. Taking proactive steps not only improves immediate well-being but also helps prevent long-term complications that can arise from prolonged oxygen shortages. By staying informed, you can better protect yourself and your loved ones, ensuring a healthier, more resilient life. 9. Nausea or vomiting. Nausea and vomiting can be surprising symptoms of low oxygen levels in the body. Like all organs, the stomach and intestines require oxygen to function properly. When oxygen levels drop, the digestive system becomes stressed, leading to discomfort, nausea, and sometimes vomiting. These symptoms are often mistaken for unrelated issues, but they can provide important clues about underlying oxygen deprivation. Additionally, nausea can stem from the brain itself. The brainstem contains a vomiting center that regulates nausea and vomiting reflexes. When this area doesn't receive enough oxygen, it may misfire, triggering these responses even without digestive distress. Vomiting may also be the body's reflexive attempt to address internal imbalances, although this is not always effective. While nausea might seem minor, repeated vomiting can lead to dehydration, which worsens the body's ability to transport oxygen efficiently. Treating these symptoms typically involves rehydration and restoring oxygen levels. If nausea or vomiting occurs alongside other signs of low oxygen, such as fatigue or breathing difficulties, seeking medical care is critical to address the root cause. Tingling or numbness. Feeling tingling or numbness in the hands, feet, or other extremities can signal low oxygen levels in the blood. Oxygen is essential for nerve function and proper blood flow. When oxygen delivery is compromised, communication between the brain and the affected areas may be disrupted, leading to sensations of pins and needles or complete numbness over time. These symptoms often start mildly but can progress if the oxygen shortage continues. Poor circulation, common in people with heart or lung conditions, exacerbates the problem. Fingers and toes are particularly vulnerable due to their distance from the heart and lungs, where oxygen is absorbed and circulated. Tingling and numbness are also associated with carbon monoxide poisoning, which directly blocks oxygen transport to tissues. At high altitudes, reduced oxygen availability can cause these symptoms as blood flow to extremities diminishes. Treatment typically involves improving oxygen levels through supplemental oxygen, better posture to enhance circulation, or addressing underlying conditions such as heart disease or respiratory issues. 11th, headaches. Headaches are one of the earliest and most common signs of low oxygen levels, but they are often dismissed as tension headaches or dehydration. The brain is extremely sensitive to oxygen shortages. When oxygen delivery is insufficient, blood vessels in the brain dilate in an attempt to increase oxygen supply. This causes pressure changes that trigger headaches. These headaches can range from mild to severe, often presenting as a throbbing or pulsating pain. If ignored, they may escalate to more serious neurological symptoms such as confusion, dizziness, or even fainting. Headaches are a warning sign of hypoxia, low oxygen levels, and should be taken seriously, particularly when they occur alongside other symptoms such as fatigue, rapid breathing, or visual disturbances. 12th, rapid breathing. Rapid breathing, medically known as tachypnea, is a natural response to low oxygen levels. The body attempts to compensate by increasing the breathing rate, delivering more oxygen to vital organs and tissues. However, this increased rate is often shallow, limiting the efficiency of oxygen exchange in the lungs. Rapid, shallow breathing can lead to hyperventilation, a state where too much carbon dioxide is expelled, causing additional symptoms such as lightheadedness, tingling in the extremities, and even more challenges in oxygen delivery. Conditions like asthma, chronic obstructive pulmonary disease, COPD, or pulmonary fibrosis can cause chronic rapid breathing. Sudden episodes may result from infections, respiratory failure, or high-altitude exposure. In children, rapid breathing can indicate serious respiratory or systemic infections, requiring urgent medical attention. Tachypnea can be exhausting, compounding symptoms such as fatigue and confusion. Treatment focuses on stabilizing oxygen levels through supplemental oxygen, ventilatory support, or addressing the underlying cause. Low oxygen levels manifest in a variety of symptoms, from nausea and vomiting to headaches, tingling, and rapid breathing. Recognizing these signs is crucial for early intervention and treatment. Whether caused by chronic conditions, high-altitude exposure, or sudden medical emergencies, addressing oxygen deprivation promptly can prevent further complications and protect your overall health. If you found this information helpful, Give this video a thumbs up and consider subscribing for more health-related insights. Don't forget to share your experiences or ask questions in the comments. We'd love to hear from you. Stay informed, stay healthy, and we'll see you in the next video.